To the program, Dr. Leen Navaravong. He is with a UnityPoint clinic, talking about something. If you've been watching TV any length of time, you've seen these AFib commercials, and you might be wondering to yourself, what in the world is AFib? And that's exactly what you're here to talk about.
Thank you so much for having me today.
Well, first, let's explain, what is AFib?
So atrial fibrillation is the most common arrhythmias worldwide, and also one of the most common arrhythmias in the United States and in North America. So atrial fibrillation is the disorganized, fast, and irregular arrhythmias on the top part of the heart.
Okay.
So heart has 4 chambers. The top 2 parts are atrium, and the 2 bottoms were the ventricles. So this is a fast, irregular, disorganized rhythm that generates from the top part of the heart. And it causes patients to have the feelings of irregular heartbeats, palpitation, fatigue, decreased energy, and sometimes could even cause passing out.
What is this? I mean, the different parts of the heart are firing at different times? How does that?
So it usually comes from triggers in a certain spot in the upper part of the left side of the heart. And when that triggers come into the heart chamber itself, it becomes disorganized and cause multiple areas of the upper part of the heart to firing at their own rate, at their own fast, irregular, and disorganized rate.
So
that's
they're not
why.
in sync.
Yes, correct.
Can you feel it literally happening as it's happening? Can you feel?
Yes, so most of the people actually can feel that their heart beating faster, their heart beats irregular. And because of that, it change some mechanics in the heart contractions, and some of the people can feel like their energy gone down.
Okay.
They feel like they didn't have much energy to do more of the work. And in some patients, what could happen is when the top part of their heart become fast and disorganized for quite some time, it can decrease the function in the bottom part of their heart. Somebody may have heard the word ejection fraction, which is one of the way that we quantify the function on the bottom part of the heart.
Ejection fraction. So what's coming out of?
Yes. So what's coming out from the heart in each beat will decrease because of the heart become fast and irregular.
So these are, I'm sorry, these
Yes,
are,
please.
there are cells that send out electrical signals.
Correct.
To regulate the beating of the heart. And
yes.
What's happening essentially here is that some of the cells are behaving badly.
Yes, so aside from the atrial fibrillation, there are similar syndromes, called 6 sinus syndromes and atrial fibrillation that usually comes, hand in hand. So 6 sinus syndrome means the normal area inside the heart that generate the electricities become less functioning or decline in their function based on a lot of multiple reasons, high blood pressures, diabetes, or when ones become aging. And with that, so when the normal function areas decline in function, this irregular focus starts to act up, and that irregular focus, when it acts up, come into the heart, cause the erratic or disorganized electricity, and atrial fibrillation develops.
Okay. Does it happen all at once, or does it slowly get worse?
I think typically it starts as, when they are younger, they have some feeling of palpitations, but usually it's not that often and it's not that long. But as you grow older, as the time goes by, as you're not taking care of yourself, not reduce the risk factors, not control the blood pressure or diabetes, not exercise, those things can progress. And it can become from a short, brief duration of AFib here and there once in a while to become what I call sustained. It lasts for days or for hours, that sometimes patients feel bad. They need to come into the hospital to get the treatment, acute treatment to slow their heart rate down, or do some medical procedures to restore the normal rhythm.
So it is treatable?
It is treatable.
Okay. Now you guys have something coming up to get a lot of information out about this, a luncheon coming up, and that's happening next month.
Yes. So it is an event that organized by UnityPoint Health at Methodist Hospital. So it is lunch and learn on February 11:30 to 1. So it's free for people who interested in this event.
Yeah, this is a free deal, but you need to get registered for it. You can't just show up. You need to let them know you're coming, right?
Correct. Yes.
All right. So I think we can handle that. But it's good to know that we'll be able to have some information like this available at no cost, and then
Correct.
take away some really valuable information.
Yes, and one other critical things of the AFib is it's stroke. People with atrial fibrillations, they have irregular disorganized beats inside their heart, and they are prone to develop stroke. And stroke is one of the very common devastating disease that sometimes it causes you to be crippled or unable to do tasks or things that you were able to do in the past. We nowadays have ways to prevent stroke in people with atrial fibrillation. We have a lot of blood thinners. Some people might have heard Coumadin, but nowadays we have a newer agent that does not require frequent blood check. At least 3 or 4 in the markets right now that FDA approved to be used, and at UnityPoint Clinic we have all those options to discuss with the patient as well.
Good.
Yep.
Now, once you find out that you have AFib, this is something you have to keep an eye on for the rest of your life, isn't it?
Yes. So the goal for treating AFib is the most critical one is to make sure that we reduce the risk of ones to develop stroke. So blood thinner is the key. The second thing is we want to make them feel better. So that to make them feel better is the options. We have a lot of treatment options that we can discuss, including medicine to slow down the heart rate, medicine to suppress the atrial fibrillation, and there is a medical procedure that I'm performed called ablation, which also could help eliminate the AFib or reduce the burden of atrial fibrillation that one has.
Wonderful. Well, doctor, thank you so much for this
Thank you.
information. And again,
Thanks
don't
for having
forget,
me today.
the luncheon is coming up, and it is free, but you need to get registered for this. UnityPoint.org/a-fib and get signed up for it, and you can learn more about this.